share if you care, like, comment, subscribe. I'll show you what I do for Barbara today. Go ahead, turn your face to the right. And I'm going to rub her back a little bit. When you started care here, you had some back pain and neck pain. How's it going?
Wonderful now.
It's wonderful now. All right. And I wanted to show everyone what we do here. And I'm using a fast force technique. A technique that lines the spine up before we have a chance to tighten up. So it's virtually painless and very effective. And I'll show you the analysis today. Is this or this tender? These are the sacroiliac joints. Is this or this tender?
The left is more tender.
The left is tender. She has some inflammation and swelling deep in the joints of the sacroiliac area. And most of us do. Most of us have chronic lower back pain. Statistically, about 80% of us suffer chronic lower back pain. So I'll start here and we'll adjust her pelvis. And I'm using a handheld instrument. How this feels.
It just feels like a release. It like releases the tension.
It releases the tension. Okay. If the bones are stuck, we can get them moving properly again. And I'm using the impulse adjuster to do that. And I'll show you a different technique, a technique that's virtually painless and very specific. Here we go. We'll open up the space between the vertebrae where the discs are. Here we go. And people wonder if chiropractic can help with discal problems or so-called slip disc or discal protrusion. And that's what chiropractors are very good at. And this is a wonderful technique for discal bulging or discal degeneration. And I'm feeling with my hands and I'm lining up her vertebrae. And this is called a chiropractic adjustment. Chiropractors adjust the spine and they take pressure off the nervous system. And I'm going to check and see if her hips are moving correctly. And when I pull the left leg out, it's a little limited. That left hip is somewhat limited. And I'm going to work on the muscles that let the hip move out, and then I'm getting a little bit more movement after the adjustment. I'm feeling in her legs and making sure that she doesn't have knots in her legs. And I'm going to do the same thing with the right hip too, because it's not internally rotating. Her foot doesn't come out enough. And I'm going to go ahead and adjust the right hip and the muscles that connect to it and check it again. And it's working a little bit better. It's moving a little bit better. I'm going to check her legs for knots in the legs. Bring your head into the center. And now we'll do some tests for mobility of the neck. And she has some limitation or restriction of motion in the neck joints. And without care, those joints will degenerate. So I'm going to move the vertebrae, and I'm using a different adapter on the instrument to get some movement deep in those joints. Here we go. And that's a very comfortable adjustment. It's a virtually painless technique. And I'm going to move her neck left to right. And to the left it moves very well, but to the right I hardly feel any movement. You could see the difference. I wanted the audience to see that to the left it moves just fine, and to the right it's hardly moving. It should be more mobile from left to right. It should be symmetrical, but it's not. And I'm going to make some adjustments here, and it's still movement deep in the joints. And immediately after, you could see the difference, that there's more movement there. But there's some swelling deep in the joints, and I could feel it. And I'm going to make an adjustment to Barbara's neck to take pressure off the nerves and get her spine moving again. Did you have headache yesterday or today?
A little bit today.
A little bit today. So this is the headache bone, and we'll line that up, and that should give her significant relief and definitely get her neck moving. There we go, more normally. That's what I wanted. And now I'm going to get rid of the stress in her shoulders, because we all carry stress here. Everyone has stress and tight muscles, just dealing with technology, dealing with the computer. And we store stress right in here in the neck and shoulder region. And I'm going to work on her shoulders and get rid of the stress. And I'm going to feel with my hand. And if any of the vertebrae or backbones are crooked, I'm going to line them up. That's what chiropractors do. They line up the spine and take pressure off the nervous system. And it's the nervous system that allows us to heal. There's a power that rushes through us when we're in good alignment, from the brain, through the spine, to the living cells. When everything's lined up, there's a power that rushes through us from above down and from the inside out. And she'll enjoy more life and more energy because of these adjustments. And I'm feeling with my hands, and I'm feeling which ones are out of alignment or subluxated. Subluxation means bones out of place, interfering with the nervous system. So chiropractors reduce subluxation, take pressure off the nerve, and allow the body to heal itself. So I'm working from the top down. Here we go. And making sure that everything's lined up. And before she leaves, I'm going to ask her, go ahead, turn your face to the right. Is there anything else that you'd like examined in particular today? That you'd like checked in particular?
Will you look at my feet?
Yeah,
My
well,
big toes?
let's go. So she's got some big toe problems. And you could see perhaps that this right toe in particular, let me lift this up. It's a little inflamed over here. She's starting to get a bunion right here, and that's a very common problem. We'll check the left one as well. The left one's not as bad, but you could see from left to right, let's put them both up, that right toe is a little inflamed. She has some inflammation there and swelling, and she's starting to get a bunion right here on that toe. So what are we going to do about it? She's blessed with nice arches over here, but I'm going to work on this arch too. There's two arches in the foot. One is here and the other one should be here, and I want to have more arch here and line up the little bones in her feet and go ahead and make some adjustments to her feet. And I'm going to traction her toe, and I just got a release. I don't know if you heard that, but that toe just popped. She felt it, right, Barbara? And I'm going to work over here because as far as the feet are concerned, what we do on one side, we usually do on the other. And I'm going to give her a nice toe adjustment, pull out that toe a little bit, make sure. He had neck, mid, and lower back pain. What would you say to someone who's afraid of getting adjusted, Ezra?
Well, it's actually really great. Every time I'm done, I feel really relaxed. And I also came here because I had migraines, and I actually haven't had a migraine in probably 3 weeks now.
Amazing.
I think I might have had one migraine in between, but I used to get them sometimes every day, sometimes every other day. It was actually stopping my life pretty hard, and yes, you did.
Very good. Is this or this tender?
Yeah, a little bit on the right side.
On the right side. So he has some inflammation in his lower back over the sacro iliac joint, and I'm going to line that up first and work from the bottom to the top because everything has to be lined up for us to be and stay healthy. How's this in the middle?
That's pretty good. It's a little tender.
A little bit tender. Subluxation or bones out of place happens from day one. Just coming into the world. And Barbara, obviously you brought him into the world. Barbara's the mom and the camera person today. How was his birth?
His birth was very smooth.
It was smooth.
Yep,
okay.
it was.
Wow.
It was.
That's the first trauma. It takes 60 to 90 pounds of force just to get the baby out of the birth canal. And then we fall about 3,500 times before we learn to walk. So there's a lot of trauma just in the birth process and development. And I'm going to line him up from the bottom to the top because he's young and strong. How old are you, Ezra?
I'm 20 years old.
20. So he's quite active, you can imagine. And you played some sports, right? Had some injuries?
Well, yeah, when I was younger, I did a lot of snowboarding mainly.
Snowboarding.
Skateboarding,
I got
snowboarding,
Yeah.
soccer, kung fu, parkour.
All the stuff.
Parkour. That'll mess you up, right?
100%.
Here we go. I'm gonna check out his hips and make sure his hips are working and they're moving in and out properly. And this hip's working and moving in and out properly. Bring your head back in the middle. And I'm feeling with my hands, and he's more mobile than his mom, but he's also a lot younger. And to the left, his spine moves well, and just like his mom, there's some limitation of movement to the right. So there might be a genetic component to this, because they're both subluxated right here. And this is the headache bone. This is the one that helps with migraine. It helps the neck move properly, and after the adjustments, much better movement. So no wonder his migraines went away. If this vertebra is out of alignment, this neck bone goes out of place, it causes migraine, headache, irritability, fatigue, nausea, vomiting, blurred vision, loss of memory, loss of concentration, difficulty sleeping. So I'm going to make some adjustments, particularly right here, and get that headache bone lined up. I'm going to work on his shoulders too, because we're all under stress. Here we go. Here we go. Here we go. And I'm going to feel with my hands that if any of the vertebrae or backbones are crooked, I'm going to line them up and take pressure off his nervous system. And I'm feeling with my hands, and I want to make sure that he doesn't get hunchback. I want to make sure that everything's lined up. Adjustments here help the heart, help the lungs. Adjustments here help build our resistance to disease of all kinds. Adjustments here help the kidneys and help the adrenal glands. And I'm going to feel with my hands and make sure that everything's perfectly lined up, and work on the ribs as well, because if ribs go out of place, they can be very painful. Here we go. And I want to make sure that he has good posture and that everything's lined up properly. Here we go. Let's go today right in here. Is there anything else you'd like examined in particular today, Ezra?
No, I think we're all good here. That was awesome.
Go ahead, turn your face to the right, and then turn it this way. What would you tell someone who's skeptical about getting adjusted? What would you tell someone who's holding back, who's afraid it might hurt?
Stop being scared. This is dope.
That's good advice. Hey, share if you care, like, comment, subscribe, and I'll be back with something powerful and positive for you and yours.